Namaste, I am Dr. Kanhu Panda, child specialist at Care Hospital, Bhubaneswar. Today we will discuss on baby vaccination. Immunization and vaccination are very critical for any newborn baby. For the initial 1 year of life and even later up till growing age, we have got a recommended Indian Academy of Pediatrics immunization schedule according to which we have to vaccinate the kid and immunize the kid against all kinds of vaccine preventable diseases. At birth, we give BCG, which prevents tuberculosis, severe forms of tuberculosis. We give oral polio vaccine and we give hepatitis B vaccination at the time of birth within the first 24 hours of any newborn. Then, at the age of 6 weeks, 10 weeks, and 14 weeks, we have got a primary vaccination schedule against diphtheria, pertussis, tetanus, which is combinedly known as DPT. We have got injectable polio vaccine. We have got hepatitis B and H influenza type B bacterial antibacterial vaccine. Along with, we have got pneumococcal conjugate vaccine and oral rota vaccine. So, against 8 preventable diseases, we are covering them with all these kinds of vaccination at the age of 1.5, 2.5, and 3.5 months. At the age of 6 completed month, then comes the role of influenza vaccine. Along with that, we can also give one shot of a typhoid conjugate vaccine that prevents the occurrence of typhoid among children. The influenza vaccine is in the form of two inactivated killed vaccines to be given at 4 weeks apart at 6 month completed and 7 month completed age, whereas typhoid conjugate vaccine only single dose is needed anytime between 6 to 9 months of age. At completion of 9 months of age, there comes the role of measles, mumps, and rubella, which is a live attenuated vaccine. Along with that, we again supplement with a dose of oral polio vaccine. And in some cases where endemic cases of meningococcal cases are seen, we can give meningococcal conjugate vaccine first dose at the end of 9 completed month, second dose at the end of 12 completed months. After the first year of life, generally we say after the first birthday of life at 12 completed month, we then give first shot of killed hepatitis A vaccine. Or if we are giving a single shot, then we can give a live hepatitis A vaccine also. After completion of 15 months of life, we give the second dose of measles, mumps, rubella, along with the first dose of varicella vaccine that protects against chickenpox. So after 18 to 19 months, we generally give the booster shots of DPT vaccine, diphtheria, pertussis, tetanus booster, along with we give a pneumococcal conjugate vaccine booster. And at the completion of 24 months, that is after the second year of life, if some kid has missed the doses of meningococcal conjugate vaccine at 9 and 12 months age, we give one dose of meningococcal vaccine. And nowadays, new recommendations may come up, which may also promote another shot of a typhoid conjugate vaccine booster at the age of 24 months. In those endemic areas where Japanese encephalitis is common, we give 2 doses of Japanese encephalitis vaccine at the completion of 12-month age and 13-month age. Then after second year of life, every year during the pre-monsoon time, we can vaccinate with one shot of annual influenza shot to every kid up till 5 years of age. And after completion of 5 years of age, we go for again the boosters of diphtheria, pertussis, tetanus, injectable polio, and MMR booster. And at the end of 10th life, that is after 10 years of life, we go for a Tdap booster, which is an attenuated version of tetanus, diphtheria, and pertussis. Among females, we can vaccinate within the age of 9 years till 16 years of age with HPV vaccine, that is human papillomavirus vaccine that protects the females against cervical cancers. It comes as a 2-shot schedule to be given at an interval of 6 months. We can even vaccinate boys in the age group of 9 year to 16 year with HPV vaccine, which will prevent them from other kinds of papillomaviral infections like anal warts and anal cancer also. So likewise, we give the vaccines to all the kids and help in building the immunity. Thank you.